Good evening, everyone. My name is Jule in Henstenburg, and I am the director of the nutrition program here at Salle University. So we in our major, we get a Bachelor of Science in Nutrition. What do nutritionists do who actually have a college degree? Because you probably are familiar with the word nutrition or nutritionist. We work in three major areas in our jobs. One of those is in healthcare and hospitals and things like that. So it's when people develop chronic illnesses such as diabetes or heart disease or cancer. Acute illnesses, we play a role in burns. We play a role in acute manifestations, liver problems and things like that that are amenable to nutrition treatment. And we also work in disease prevention, so wellness and things like that. Our second major area of work is food and food management and food systems. So we work for food companies, we work for nonprofits, we work for things like the Food Trust that put farmers markets throughout the city and do nutrition education at them. So food systems and food in general is an area we work with. And our third major area is education and public health. We are more and more in school systems. We are more and more in supermarkets. Have you seen a dietitian or nutritionist in a supermarket? Anybody yet? Do you do your own food shopping? Okay. Keep your eyes open because that's a really new area for us, but we're in Whole Foods. In this city, we're in Whole Foods, ShopRite, Giant, and Wegmans. Okay, so we have we're building presence in those arenas. And those are where we really help people in the community to make healthier food choices. And that is actually the basis of some of my dissertation work is what do people actually do when they go into a supermarket in an area of Philadelphia that is previously a food desert. Anybody know what a food desert is? Have you heard the term coined in the media? Yeah.
Yeah, it's basically a place that doesn't really get a good amount of food.
Doesn't what?
It doesn't get a good amount of food circulating throughout the area.
Right. So it's typically considered a place where sort of fresh, healthy food is not readily available. It's typically considered a place where people will go to small markets or convenience stores to buy the food that they need for a lot of the time. And it's typically considered where there's no real good access to fresh produce, the things that make people healthier. And we have a lot of data in our field that show that people who eat more fruits and vegetables are healthier in every way, shape, or form. We're not sure why, we're not sure which part of the fruit and vegetable that is. The nutrition science is still being worked out there. But the first step, we think, is to give communities access to better food beyond that you can get at convenience stores. So there's been a big initiative to build supermarkets in food deserts. And so that's where I know that you have been discussing a little bit of the Exploring Nutrition project, right? A little bit. So that's where that kind of project comes in. This area around LaSalle University was previously considered a food desert before the Fresh Grocer was built. And so before that, people had a hard time having good access to fresh food, and now they have better access. So the questions are going to come up about, well, I'll ask you guys this question, because these are some of the things that I'm thinking about and studying and looking at. But it's also some of the things that we're talking about in the classes that I teach, because it's all centered around the issue of hunger and food insecurity, okay? So I'm going to first pose to you, what is food security? Do you guys know what food security is? Yeah.
I can take a guess.
Yeah.
Is it like you never have to worry about not having food or being short on food within a household?
Right. So food security is the definition involves people having physical and economic access to food. So your idea about not having to worry about food in the household is true. You have physical access, you have economic access, you can bring enough food into the household to feed members of your family comfortably and in a culturally appropriate way. And that's really important, the cultural appropriateness to it. How about food insecurity then? Insecurity would be the opposite of security. So what's insecurity? Right, not having economic or physical access to food, and that people cannot meet their daily food needs with what's available to them, whether it's money or whether it's access or preferences even, so culturally inappropriate food. So you've heard of dumpster diving, right? That's not a culturally appropriate way to get food. So even if people can go to the dumpsters from the restaurants, that's not the way that we culturally eat in the United States, right? So that would be also food insecurity. We also talk about hunger as well as food insecurity. What's hunger then? What's hunger? What makes that different than access to food? What's hunger? What do you know? Hunger? Hunger is a physiologic issue. Hunger is the feeling of painful sensations that come from lack of food. So food insecurity is that you don't have physical or monetary access or culturally appropriate access to food. And then if you also experience physical discomfort and manifestations of no food, that's hunger. So when we talk about this area, we say hunger and food insecurity, as they both are kind of different things, but they go together. Okay. So some of the things we're looking at in my classes and also in the area around LaSalle, I'll tell you a little bit about what my classes have done recently in terms of service learning in this area that surprised them. But first I'm going to say to you, who do you think are hungry in the United States? What are the population groups that experience the most hunger, do you think? Who do you think is, yes? Homeless is one of the categories. So that's very good, because homeless do experience hunger very acutely. They do a lot of the visits to soup kitchens and the like, okay? Who else do you think is hungry in the United States? These are the more surprising, that people who are also at the soup kitchens with the homeless. Who's there, do you think? Surprisingly. This is going to surprise you maybe a little bit. You guys talked about this at all? Yeah, okay.
Yeah,
Who's hungry in the United States?
70% of our population.
Okay. Well, it's not quite that high, but it's pretty high. What's the number? Actually, I don't have a number at my fingertips. I'm just wondering what groups? Yeah.
Poor?
Well, the poor are hungry, but who are they? So let me give you an example. Are they adults? Are they college students? Are they older adults? Are they elderly? Are they children? Are they men? Are they women? Are they families? Which of these groups do you think are where hunger is the most prevalent? Children. Good. Who else?
Senior citizens?
Yes. The elderly. Second, that's right. The second top group, and then and the third group that's most hungry,
I just saw
or has experiences most
college
food.
students.
You know what? That's an increasing group, but it's not the biggest. Who's the third biggest? Which kind of adult? Let's say men or women?